First aid for low blood sugar. Low blood sugar can happen in people who take medications for diabetes or in patients, often young babies, who are critically ill. When a person's blood sugar goes too low, they can get anxious, shaky, and confused. Eventually, they can have a seizure or lose consciousness. This woman has diabetes. She did too much physical activity today without eating much food. She is sweaty, shaky, and sleepy. If there is a blood sugar meter available, check the level of sugar in the blood. Less than 70 is too low. A sugary drink will bring the blood sugar up quickly. Mix a large spoon of sugar in a cup of water, or give juice or soda. If the blood sugar goes too low and the patient becomes unconscious, call for help. Give sugar paste instead of a sugar drink so the person does not choke. Sugar paste is made by adding a little water to some sugar. Put the sugar paste between the cheek and gum every few minutes. If the person faints or has a seizure, this is an emergency. You need to take the person to a hospital. Give small amounts of sugar paste every few minutes on the way to the hospital. Remember, people whose blood sugar goes too low can appear sweaty, confused, and sleepy, and may lose consciousness. A person with low blood sugar needs sugar.